Hi, this is Dr. Siddharth Gautam, and today let's talk about Lissencephaly. The word literally means a smooth brain. So, what happens in this condition is that normally during fetal development, the neurons migrate to form the folds and the grooves, which is the sulci and the gyri. This gives the brain its wrinkled surface. But in Lissencephaly, this migration is impaired, and hence the brain surface appears to be abnormally smooth. Now, why does this happen? This is most often linked to genetic mutations, especially in the LIS1 or the DCX genes. Now, sometimes prenatal infections or poor blood flow to the developing brain can also contribute to this particular condition. Children born with lissencephaly usually present with severe developmental delays, feeding difficulties, muscle stiffness or floppiness, and seizures that are often resistant to medications. The severity depends upon how much of the cortex is actually affected. The diagnosis is dependent upon the MRI. In fact, the MRI is a gold standard. It clearly shows absent or simplified gyri and sometimes even a thickened cortex. Now, what is the treatment and the outlook? There is currently no cure. Management focuses on controlling the seizures, optimizing the nutrition, and providing physiotherapy and supportive care. The prognosis really depends upon the extent of the brain involvement, but most of the children require lifelong care. So, lissencephaly is not simply a structural abnormality. It represents a fundamental error in early brain development. Understanding this particular condition helps us to advance the genetic counseling, and the supportive therapies that are required to help these patients. Stay tuned to University Connect to know more about this.